Jeremy Corbyn.
Thank you, Mr. Speaker. Could I just put on record our pleasure at the return of the Northern Ireland Assembly and hopefully the restoration of the peace process in Northern Ireland? I know there's a statement coming on this after Prime Minister's question time. Can the Prime Minister let the British people know why, after almost 10 years of Tory government, patients are waiting longer for essential NHS care, whether it's in A&Es, on waiting lists or for a GP appointment?
Mr. Speaker, we are investing record sums into the NHS, and I think indeed the House should be very proud today that we are passing the NHS funding bill, which will guarantee such funding not just this year but into the future.
Well, passing legislation that will guarantee underfunding of the NHS, yes. Mr. Speaker, the number of patients waiting more than 4 hours in A&E is now at its highest on record for the second month in a row. We've had months of promises, but people need action. There probably isn't a family in the United Kingdom which hasn't been affected in some way by cancer. Yet last year we saw 1 in 4 patients waiting more than 2 months for the start of their cancer treatment. How many more patients will face what are life-threatening delays because our NHS is understaffed and underfunded?
Mr. Speaker, as the right honourable gentleman knows, there is a massive demand on the NHS, which, as he also knows, is doing a fantastic job, particularly actually in oncology, where tremendous progress has been made. He's right to signal the delays that people are facing, and they are indeed unacceptable, and that is why we are investing in 50,000 more nurses. That's why we're investing in 6,000 more GPs, and that is why this government is investing record sums in the NHS. We will get those waiting lists down.
20,000 of those 50,000 already work for the NHS, actually, Mr. Speaker. But delays in cancer treatment can reduce a patient's chance of survival. The target of 85% of patients to be seen within 2 months was last met 4 years ago in December 2015. Action is needed urgently. Last week we heard the heart-rending case of a 92-year-old RAF veteran in Leicester who had to go through the indignity of waiting almost 12 hours on a hospital trolley because there were no beds available. I want the government to apologise to him and many others, but to explain why, despite the extraordinary efforts of NHS staff all over the country, over 2,000 patients had to wait more than 12 hours before they could get into a hospital bed last month alone.
Well, Mr. Speaker, as he's right to highlight the case of the RAF veteran, and I think everybody in this House will have every sympathy for people who have a bad and unacceptable experience in the NHS, and we all share that. On the other hand, I would say that most people in this country, most patients of the NHS, have a fantastic experience of our healthcare, and we should pay tribute to our nurses and our staff. And the hospital he mentions, the hospital at Leicester, is one of those which, as he knows, we are rebuilding under this programme. 14 new hospitals, 20 upgrades under this Conservative government.
The A&E has already been rebuilt in Leicester, actually, I understand it. The problem is the Prime Minister promised 40 hospitals. In reality, it was 20, then it became 6. Mr. Speaker, this issue of people waiting in trolleys is a very serious one. The number doubled in December and now at its highest ever level on record. The Prime Minister promised to put the Conservative Party's inadequate NHS funding pledge into law. Can he explain why it is necessary to cement into law a pledge which the Health Foundation has said is below the amount needed to maintain current standards of care?
Mr. Speaker, it is only under this Conservative government that we have the resources that will enable us to invest in our NHS. And it's because of the stewardship of the economy after the wreckage that Labour left when they were in office that we've been able to make those colossal investments. And I would remind him, not only was it this Conservative government that rebuilt the A&E, as he correctly points out, it is this Conservative government that will be rebuilding the entire hospital. And we are in Leicester, and we are putting more money into the NHS as a direct result of our careful management of the economy.
Jeremy Corbyn.
Well, I understand another hospital has been closed to pay for it, Mr. Speaker. The question is, why would the government need to put into law an inadequacy of funding for our National Health Service? Health professionals have said the NHS needs more money than the government is saying in order to keep patients safe. It's now been almost 3 years since the government promised a green paper on social care, and 7 months since the Prime Minister himself stood on the steps of Downing Street and said he had prepared a clear plan to fix the crisis in social care. Well, what's the hold-up? Where's the plan?
Well, Mr. Speaker, I'm delighted by his constructive attitude, Mr. Speaker, because as he knows, we do intend to begin with cross-party talks to build a consensus. And I think there is a growing consensus in this country on the need to tackle the issue of social care so that everybody has dignity and security in their old age. Nobody has to sell their home to pay for the cost of their care. We can do it, and we will do it. With the help and cooperation of the Labour Party and other parties in this House, we will go ahead with a fantastic plan for social care. I look forward to his support, but I would point out to him that it is thanks to this Conservatives' stewardship of the economy that we are now, and indeed the mandate of the people that we have, that we are now able to tackle a problem that was shirked not just by the Labour Party, but for governments for decades after decades, and we're going to do it now.
Jeremy Corbyn.
Mr. Speaker, I don't know if the Prime Minister had a chance to read the Labour manifesto in the election, but we made it very clear. We have a plan. We have a plan, a very clear one. It is free personal care, it is more funding, and it is support for carers. And I'm very happy to send him another copy of our manifesto so he can read it. The Prime Minister has said many times he's going to put this NHS funding issue into law. But all this gimmick means is even longer waiting lists, more delays for cancer patients, and more A&E departments bursting at the seams, while patients continue to suffer while he continues to provide excuses. If he's really committed to fixing the crisis his government has created over the last decade, he should end the empty rhetoric and back our proposals to give the NHS the funding it needs, rather than putting into law an insufficiency of funding. The NHS is our most precious national institution. Fund it properly, that everyone can rely on it, those that cannot afford private health care.
Well, Mr. Speaker, I'm delighted he's still fighting on the manifesto that he submitted to the attention of the British people at the last election. I think it was pretty clear what they thought of it, what they thought of the credibility of the promises that he made. But it was also clear what they thought of what we're going to do, because they see that we are the party of the NHS, Mr. Speaker. They see that it is this government that invests in hospitals, in schools, in policing, in bringing crime down. And that is because it is this government whose careful stewardship of the economy has led to record employment, record low unemployment, which delivers the tax revenues that enables us to pay for the whole of society. Whenever Labour is in office, Mr. Speaker, they wreck the economy and they put unemployment higher and make us less able to pay for great public services. We're taking this country forward, they would take it backwards.